Edema definition. Accumulation of fluid in interstitial tissue space is called as edema. Disorders that perturb cardiovascular, renal, or hepatic function are often marked by edema and effusions. Edema can cause due to increase in hydrostatic pressure, decrease in osmotic pressure. When rate of fluid movement is more than rate of lymphatic drainage, edema occurs. Edema is classified as inflammatory and non-inflammatory edema. In inflammatory edema, protein-rich exudates are seen. It is due to increased vascular permeability. In non-inflammatory edema, protein-poor transudate are seen. It is due to increased vascular hydrostatic pressure and decreased colloid osmotic pressure. Causes. First is increased hydrostatic pressure. It is due to impaired venous return. It can be localized or systemic. Localized occur due to external pressure or venous obstruction. Systemic include liver cirrhosis and long heart failure. It also occurred due to arteriolar dilatation. It is due to heat and neurohumoral dysregulation. Second is reduced plasma osmotic pressure. It includes due to decreased secretion of albumin in end-stage cirrhosis, protein energy malnutrition. Also due to increased loss of albumin in nephrotic syndrome. Sodium and water retention. Lymphatic obstruction. Morphology and clinical features. Edema is easily recognized grossly. Edema is most common in subcutaneous tissues, brain and the lungs. Subcutaneous edema, influenced by gravity. Dependent edema, pitting edema, sign of underlying renal or cardiac disease. When significant, impairs wound healing. 2. Periorbital edema, seen in renal dysfunction. Pulmonary edema, lungs are 2 to 3 times their normal weight. Sectioning yields blood, tinged frothy fluid. Seen in left ventricular failure, renal failure, acute respiratory distress syndrome and pulmonary inflammation. Impedes oxygen diffusion and creates a favorable environment for bacterial infection. Brain edema, can be localized or generalized. Brain exhibits narrow sulci and distended gyri, compressed by skull. When severe, can injure medullary centers and cause death. Peritoneal effusion, mostly due to portal hypertension. Prone to seeding by bacteria.